Hello, my name is Keith. I'm your guide here today with Get Set Up. Today's session is going to be about Medicare Part B and making sure you understand the benefits that come with the Medicare Part B. So, thank you for joining us for this session of Get Set Up Medicare Part B. So, maximizing your Medicare Part B benefits is very important. You want to make sure that you take advantage of what those benefits are and understand what's covered for your Medicare Part B. So, understanding Medicare Part B and maximizing those benefits is what we're going to talk about for the next few minutes. So, once again, thank you for joining us on Get Set Up. So, understanding your Medicare Part B, it's your outpatient, it's you're going to the doctors, you're going to the urgent care. You may go into the hospital ER room, but you don't have an overnight stay and they release you the same day. Those are considered Medicare Part B. So it's medically necessary services. Also, it includes your preventative services when you go into the hospital. So keep these things in mind and make sure that you're maximizing all of your benefits when it comes to your Medicare Part B benefits. And so things that are included, like x-rays, outpatient services, your labs, your blood work, when you go into your doctors or into the urgent care, that would be considered Part B benefit. Your preventatives, like going in to get a shot, like a vaccine at your doctor's office, that's also considered part of your Part B benefits. So you want to make sure you're maximizing, you're taking advantage of all those benefits that are covered under Medicare Part B. Your annual wellness visit when you go in to see your doctor is part of your Part B benefits. So make sure you maximize that. At least go once a year. Some people go once a quarter. Whatever it is for you as an individual, because remember, Medicare is an individual benefit, and you as the beneficiary will benefit from using these services and maximizing your Medicare Part B. Effective treatment programs, follow-up visits, considered Medicare Part B. So those things that are covered under the Medicare Part B. So remember, hospital, if you do an overnight stay, it's Medicare Part A. And things like skilled nursing, hospice care, nursing facilities, those things are all under Medicare Part A for hospital. So know the difference. We're talking today about Medicare Part B, which is your preventative, your medically necessary outpatient services. So make sure you understand your doctor visits, your outpatients, even if you did an outpatient surgery at an outpatient center and they send you home the same day because you're doing fine. Diagnostics, lab work, durable medical equipment. Let's say you go in, you get fitted for a new walker, and then they send you home. That is a Medicare Part B benefit. Heaven forbid you have some issues where you have to go in and there's some psychological things that are going on, or you need some mental health benefits, but you're going into a clinic or a doctor at their office. That is considered Medicare Part B. Outpatient. The other things are like telehealth. People think like, well, at home, does it cover under Part A? No, it actually covers you under Medicare Part B because it's telehealth and it's still an outpatient type of service. Home health services in some cases are also covered under Medicare Part B. Let's think about some other things. You go in for preventative like mammograms, colonoscopies, those type of things, or any kind of diabetes screening. That will be considered a Part B benefit. So make sure you're maximizing and you're taking advantage of all those Part B benefits under your Medicare Part B benefit program. Take advantage of the preventative things. Zero cost for a lot of preventative things. So make sure you go in and get your annual shots if you need to. Also, your flu shots can be considered and covered under Medicare in most cases at the doctor's office as a preventative visit, but it is still considered under Part B. Any other screenings that you may have to go in? Heaven forbid you have to go in for a cancer screening or prostate screening. Those are also Medicare Part B benefits, including COVID-19, which is still going around. You want to make sure that that is coded and labeled under your doctor visit as an outpatient Part B benefit. So make sure you choose the right provider, your doctors, your urgent cares that you go to, and make sure they are taking and accepting the Medicare Part B benefit. If you have a Medicare supplement, then that would be covered under the supplement, or a Medicare Advantage plan, which is Part C, then your Medicare Part B is included with that as well. Understand your costs and your out-of-pocket. So there's deductibles, there's monthly premiums, and so make sure you understand coming into 2025, there are going to be quite a bit of changes that are going to be happening. So you want to make sure you understand everything, that you are maximizing your benefits, that you are understanding what the Part B benefit is, what your Part B deductible is, what your Part B premium may be as well, and make sure that you fix your income based off of those needs and your budget. So premium, deductible, all part of Part B, so be prepared for that. Typically things are increasing, so talk to your provider, talk to your Medicare representative, or go on Medicare.gov, or even your Medicare and You booklet when you get that in the mail coming up here this fall, and go over the benefits. Make sure you understand exactly what's covered so you can maximize your Medicare Part B benefits. So make sure you keep a track of those benefits. It's important to know what you've already taken care of or what you've already went in for a visit, and make sure it is coded correctly. Sometimes people don't understand going into a hospital and you are not admitted inpatient into the hospital for Medicare Part A to cover it, and you're in observation status, you are still considered under Medicare Part B outpatient, even though you're in observation status overnight. So make sure you understand all your benefits, how they work to your behalf. In conclusion, take full advantage of your Medicare Part B benefits. And so follow up with your doctors, your providers, your current Medicare provider. You're also want to double check your insurance carriers, make sure you're getting the right benefits for them and everything that's covered under your plan. Look at your plan closely. A lot of folks got that ANOC letter, the annual notice of change. Look at that and make sure that you get everything understood prior to January 1st, 2025, when things change. You may want to look at a new plan to make sure you get all your benefits under Medicare Part B. Also, go online to Medicare.gov and they'll be glad to help you there, or just pick up the phone and give them a call. Okay, folks? So once again, we thank you for joining us here at Get Set Up for another Medicare session. My name is Keith. Take care. Have a great day.